Hundreds of thousands of Americans travel overseas for medical procedures. They range from the routine operations to experimental and sometimes risky operations. Joining us now to talk about it all, surgeon, scientist, Dr. Rahul Jandial. Yeah, he did. Medical tourism, Kobe Bryant, the most notable recent example of it. He goes to Germany for knee surgery. What's wrong with American doctors?
Well, that's what people are wondering. Why does Kobe Bryant, who has all the resources in the world, choose to go to a different country? He chose an experimental therapy to fix his knee problems that sometimes works, sometimes doesn't. Our government hasn't approved it yet. And people are wondering, well, why not? If Kobe Bryant is choosing it and other famous people are choosing it, why not? I think that's the trick here, is figuring out when I go overseas, should I go and get a nose job? Should I go and get a heart transplant? Should I get a cancer-curing stem cell magical pill? And you just have to tailor what you're going overseas for.
Well, then there are people that are going places for, Mark was talking about dentistry. There's a lot of people that are going south of the border to other places because of the cost effectiveness of it.
People go south of the border for dentistry and cosmetic surgery. So you'll find trends. They go to Panama, they go to Brazil for cosmetic surgery. A nose job is 1/4 of the cost. They go, they stay in a hotel, the hospital feels like a hotel, and then they recover and the bandages come off. 2 weeks later, they come back.
But is this risky? Because do we have the most stringent kind of guidelines compared to other countries? Would you recommend doing that?
You know, that's a natural question, and I guess as an American physician, it'd be nice to say that, but I think Singapore, Thailand, if you go to these boutique hospitals that are accredited by certain national things, they're safe, and people are choosing to go
What do you mean by boutique hospital?
Well, you know, if you go to Singapore, they'll have a hospital that's meant just for Americans and Europeans coming there to get their medical care for half off, a third off. And they got American doctors over there.
Well, I'm reading some of these text messages that folks are sending into 515151. One of them talks about half of bankruptcies in America are tied to medical expenses.
That's true.
I mean, and that's one of the reasons people are being pushed into these overseas doctors.
There's no question we spend the most on health care, but our health care is not necessarily better than some other countries in Europe. So people are wondering, why spend our money here? So if you don't have insurance and you need a heart operation, and you can go to Thailand and get it for $6,000 plus the stay and the travel, that sounds like something people can afford. So they are choosing that to the number of about 700,000 to 800,000 Americans going outside of the country. 700,000 to 800,000, almost.
Well, it's interesting because Mark and I, both being from Canada, we know for a long time there was a shortage of beds in the hospitals. So people that were waiting for knee surgery that they'd have to wait on the list for like a year and a half could pay. Obviously, they'd have to have the cash, pay to come to the States to get that knee surgery. Same with open heart surgery. People that were waiting because they weren't considered, you know, they weren't the top of the list. Exactly.
Now people are going the other way, going to the rest of the part of the world that is developing. If they don't have insurance and it's going to be much cheaper, they're thinking about going there.
Is it easy enough, and obviously you have to do a ton of homework, but is it easy enough to smell out a scam, or what are some of the telltale signs?
Great point. The people that are going there are sophisticated. It's not people who are just fumbling through travel and getting random operations done. No, they go online.
These freaky, scary stories.
And I think we need to get to that. But if you want to have plastic surgery, if you want to have routine elective operations, you can actually go to Singapore, Thailand, have an American-trained orthopedic surgeon do your surgery there, have your family be there, live in a hotel-like environment. It's comfortable. It's not a bad option if that's what works out for you. And I think you do smell it when it's a sham. And now, touching on that, if you see a flyer that says dying of cancer, come to Mexico. We will take your cells and give you something back, and it's only going to cost you $25,000 to save your life.
You got to watch for that.
You got to go with your instinct. That's a scam, and you want to stay away from stuff like that.
This was a really interesting water cooler buzz. Dr. Jandial.
Ryan and John Sally.
Right?
You know,
and Dr. Jandial.
It's tough to follow him. I thought you did a great job.
Thanks.
We just call you Dr. J. You know that.
Yeah. You're our Dr. J.
You're our Dr. J. All right. Thanks so much. More information on Dr. Jandial, ktla.com/Dr. Jandial.